So Dr. Joe, having some pain in my back from sitting at a desk so long, I start to slouch. My shoulders round, but I also feel the pain in my lower back and soreness, and I just wanted to know how to treat.
So people sitting too long and then start feeling pain, the lower back pain. The most common reason can be the psoas muscle, hip flexor muscle getting too tight and short. So when you see this anatomy here, this is lumbar spine, this is the buttocks, this is a hip bone. So psoas muscle starts from the lumbar spine attached to your L1, 2, 3, 4, and then it's going into attached under your hip bone. So when you're sitting, this is a short position, shortened position. In the shortened position, you stay too long, and that muscle getting adapted to shortened position. That's gonna pull your lumbar spine later on. So this is after sitting too long, muscles getting short, and that start pulling your spine forward. So that makes a pelvic tilt, anterior pelvic tilt. So this is a normal curvature, and then psoas muscle getting short, and that's pulling, and that makes your pelvis rotating forward. This position, yeah. Because of that pressure, start feeling the pain over there. I recommend releasing hip flexor first, and then you still feel the back pain, then you can treat your back. But this is so common, more than 50% of the back pain is so common. So it's just good to stretch over there, release. So today I'm just gonna go over how to self-release hip flexor psoas muscle, show some stretching, and then treatment as well. I'm gonna show you the manual side of the treatment. Yeah. So let's go over the self-release using ball. As you can see the muscle, this muscle is a little deep inside of your stomach. This is a little deep inside. So I'm gonna use the ball, but the size is a little bigger ball than the tennis ball. To release your psoas muscle, I'm gonna use trigger point ball and then a little bigger size. So about 2 inches diameter, yeah. So psoas muscle is about here and going into your hip bone. But this is a deep inside, so we gotta put the ball a little deep. I'm gonna use my body weight. Put the ball in a little outside of your belly, but a little outside, and then you can move a little bit, and then find a little sensitive spot. Just stay there and then just breathe in, breathe out. When you breathe out, try to relax as much as possible. If that's too sensitive, you can always put a little less pressure using your elbow and hands, other body parts, give a little less pressure, and then just keep doing breathe out and try to relax. I felt a little sensitive spot here, so I'm gonna stay there for a while, and then I'm gonna go a little down, and find another spot. Okay, so a little moving around, and then try to find a little sensitive spot. I feel a little sensitive, and I feel like a little having a little spasm sensation, and then I'm just gonna stay there, and then breathe in, breathe out. You can stay there like 20-30 seconds, and you can a little pressure off. You can massage again, and then go back to the spot, and then doing the same thing until you feel a little better, less sensitive. And then you can go a little lower, and then find another spot, and then you find it, then you can do the same thing. And then let's say I released a little bit, and I can keep going down. And then hip flexor is the main area is this area, deep inside, but it also goes up to here, and that's a little surface, superficial area. So you can also go right over there, and you can release. Now, same thing, moving up and down, or sometimes side to side, and find a little tight or sensitive spot, and then you can just stay there, and breathe in, breathe out. And then this third part, there's another muscle. Iliacus tendon is attached. So psoas is going here, and then iliacus another. The muscle comes from the pelvis, iliacus, and then it goes into there. There's another tendon that's also hip flexor tendon. You can massage both of them, and then same thing. When you feel sensitive, you stay over there a little bit. Yeah. After that, you can do the stretching. I'm going to show you hip flexor stretches. So really, the side you want to stretch. Put your hands on your pelvis and tilt your pelvis a little backwards. This is anterior pelvic tilt that makes your lordosis more, make them more lordosis. And then this is a posterior pelvic tilt that makes a little less lordosis. So I want you to do a little bit posterior pelvic tilt, and then try to maintain as you're moving forward. So as you're moving forward, try to maintain a little bit of posterior pelvic tilt, then you can feel a little more. If you do anterior pelvic tilt, you're gonna feel less stretch. Yeah, so a little bit posterior pelvic tilt, and then try to maintain it. And after feeling the stretches, always breathe out. and then stay there. Important thing is always feel stretch. Always feel the sensation. So your focus is on your muscle and joint. What kind of sensation you are feeling, you gotta feel it. Then it's more effective. Yeah. If your knee is a little painful on touch on the ground, you can use this pad here and then a little posterior tilt, move forward, and stay there like this. Another variation, you can do this position and then push this knee a little outwards and then a little turning your trunk this way and then a little pushing out. Make sure your body weight goes to here. Your body weight is going there. As you're pushing this way, it's a little turning facing this way and then your body weight goes to. Okay, Nico, I'm gonna release your hip flexor to release your back tension. This is a type of myofascial release. Myo is muscle, and then fascia is the sheath, connective tissue sheath covering your muscles. Fascia also covering your organs, and then nerves, and then tendons sheath.